I think the most satisfying and rewarding part of my job is the turning around of a patient who is immobile to mobility. I think that that's very satisfying. I have several people who are wheelchair bound and are walking into my office, and this is something that I value very highly. I honestly didn't know what I wanted to do when I was deciding what my profession would be, and I enjoyed everything in my training. And it turns out that my background in construction and working on a farm, I found out through happenstance that there was a specialty that kind of featured all of my skills that preceded my training. My work on the farm kind of helped me understand that the importance of structural elements in creating something that would last. And when you build something that's going to last, you have to pay attention to certain things about the structure. And it turns out the architecture of the skeleton is very similar to the things I did during those times. The areas that I specialize in are related to joint replacement primarily. I did a fellowship for extra training in this area, and I do primary joint replacement, which is the first time you have a joint replacement, and also revision joint replacement, which is when a replacement goes bad. And also I treat fractures around joint replacements. I started my training in 2004 in orthopedic surgery, and I think that my practice is sort of an evolution, and the reason that it's different than a lot of other people is that I had the benefit of people who were at the forefront of orthopedic surgery training me, and they could see where this was going, and they kind of guided me to say, this is a priority for you to learn. My experience with robotic surgery in the area of joint replacement is essentially I've done more joint replacements with robotic assist than anybody in the San Diego area. Trust is very important in your physician. You need to trust that they have your priorities in mind. And I think it's also important to trust a surgeon, particularly when you're giving consent for a procedure, because I think anesthesia is a very vulnerable period in everyone's life. And you have to trust that the surgeon is going to do the best thing for the patient during that vulnerable period. I get really involved with the personal lives of my patients, and I think that it's really great to see patients come in who previously weren't mobile and who are now able to walk. And it's just great to, watch them walk in and, give them a high five and say, you're doing great. That's what I value in my practice.